As healthcare workers, we never want to put patients in danger.
As Quebec's COVID-19 cases continue to climb, a record high of over 10,000 cases Friday, according to La Presse, since official government data wasn't released. The province is now considering keeping healthcare workers infected with COVID-19 on the job. This potentially happening in the face of severe staffing shortages, but some say there are other solutions.
Our priority is to protect our patients, right? So I think if we did go that route, it'd be under very desperate measures. I don't think we're there yet. I think we're trying to contain what's happening right now, and we'll find ways because we always do.
Quebec is floating the idea of allowing asymptomatic COVID-positive employees to work only with COVID-19 patients and not expose new people to the virus. The aim is to limit service disruptions.
I don't think that would be a good idea, especially with how virulent the virus is.
The president of the Regroupement des agences de placement de personnel de la santé, Richard Mercier, wants to be a part of the solution. He has in his ranks more than 800 nursing assistants and orderlies ready to help against the Omicron variant, on condition that the government end the inequity between agencies.
If the playing field was even for everyone, we could have a better access to resources. We're not asking for different condition, better condition and all that stuff. We're not asking to, we're just asking that right now we need people. We need a lot of people in a short time frame. We have people who could work if those conditions were like same thing for everyone, and we could help.
Quebec Health Minister Christian Dubé has imposed a series of conditions on employment agencies since March 2020, like having a maximum cost agencies can charge the government for services. So if a nurse needs to work overtime, be paid for mileage and accommodations, the maximum Mercier's agency can charge the government per hour is $35, he says. Everything else comes from the agency.
We need to find a way to bring people aboard. What we're saying is that if like that contractual challenge that the government has, is the government was dealing with that contractual situation, it would allow us to provide the resources.
In spring 2020, the number of absent employees in the health network rose to 12,000 during the crisis. They are now at over 5,000, with that number expected to keep rising.
What I do believe we need to emphasize is, wearing our PPEs, our personal protective equipment, hand washing, hand hygiene, wearing masks, and socially distancing. I think these are key elements that we've been saying from the start.
The Canadian Red Cross will send up to 300 employees in the coming days to help out.
They've been at it for more than 22 months. It's time we find time, we need to all think together, to provide the help they need.
We will get through this, we will manage, and we will continue to serve the public. That's our goal.
In Montreal, Pamela Pagano, City News.